Onc Live Insights is a video editorial program produced by Onc Live.
So the current standard of care for patients with Hodgkin lymphoma is based on the clinical staging system. So we treat patients according to stage, early stage or advanced stage. And within the early stage disease, we use prognostic factors. So we talk about early favorable and early unfavorable disease.
So for those patients who have limited stage Hodgkin lymphoma, we typically use an approach which is primarily based around combined modality therapy. So that would use ABVD as our standard chemotherapy approach, plus involved field radiation. The exact mix of how much chemotherapy and how much radiation we give depends on a series of prognostic factors and whether the patients have low risk versus high risk disease. Like many other centers, what we're looking to do is in those patients who have very favorable risk early stage Hodgkin lymphoma to avoid radiation therapy if we possibly can. And so there are certain groups of patients now with very favorable disease who show a good response after 2 cycles of chemotherapy, where we give 2 more cycles and no radiation. But for the majority of our patients, the standard of care is still 4 cycles of ABVD plus involved field. And there are a group of patients with good risk disease where we would give 2 cycles of ABVD plus involved field. So in the early stage setting, that's still very much a standard approach. Yes, so the question of managing bulky Hodgkin lymphoma still remains a little uncertain, and the optimal approach has still not yet been fully elucidated. So the area where we are most concerned about bulk disease is in the mediastinum, where typically it's defined as patients with more than 10 centimeter diameter disease on standard of CT PET imaging. We know from historic data that that group of patients with bulky disease in the mediastinum have a relatively poor outcome compared with other patients with early stage Hodgkin lymphoma. And so the question in that group is, what is optimal therapy? For many years, and I should say that in many centers, the approach has been to treat that like advanced stage Hodgkin lymphoma. So to give 4-course chemotherapy and then consolidate that with involved field radiation. And many centers now have backed off a little from that, using slightly shorter courses of chemotherapy, 4 courses, and again consolidating with involved field radiation. There was a large German study which was performed a few years back now, which randomized between 2 types of chemotherapy, ABVD and BIACOP, and also 2 types of radiation given at 2 different doses. And I think it's accepted right now that there are a couple of acceptable standards for patients with bulk mediastinal Hodgkin lymphoma, giving either 4 or 6 cycles of ABVD and consolidating that with involved field radiation to the mediastinum.